Hi, Kara. There's comments. There we go. Hello, hello. Hey, Rachel. All right, we'll go ahead and get started so I don't take up too much of your guys' time. So, for those of you that don't know me, my name is Brooke. I'm the nurse practitioner and owner of Port St. Lucie Medical Wellness. And every Monday, I do a live and talk about new things on the horizon, specials we have. And if anybody has any questions, feel free to comment and I'll be happy to answer those. You can always text me or call me at 772-207-0080. That's the office number, but it does accept text messages as well. So I'll answer those usually. And our office is located at 702 Southwest Port St. Lucie Boulevard. So that is on Port St. Lucie Boulevard between Gatlin and the Turnpike, close to Del Rio and Port St. Lucie Boulevard. So feel free to come on in. I'm still decorating, but it's looking nicer and nicer every day. I'll be happy to see you guys if you come in. So, real quick, you all who are already been to the clinic, tomorrow you'll get a text message with the April specials. But real quick, I'll go over those just in case you guys have any questions or you understand the text messages better. So we're doing a couple get ready for prom specials. So we're doing a bio repeal and hydrodermabrasion combination treatment. So the hydrodermabrasion is the one that uses water, and it sprays it really hard on your skin, and then at the same time it's sucking, so it gets rid of all these little like blackheads and whiteheads, and it also provides a lot of hydration to the skin, so your skin's really glowy and plump, and you get a really nice makeup application for the next couple days afterwards when your skin is like that. That in combination with the bio repeal, which is a TCA peel, but it is sun safe. So it's really good for people in Florida because we're often out in the sun a lot. So it sometimes after peels, you got to wait about 2 weeks before you can go out into the sun. And with the bio repeal, you don't have to do that. You can go ahead and be out in the sun. Obviously, wear sunscreen. That's the number one thing that protects your skin. So you should be wearing sunscreen every day, anyways. But wear sunscreen. So usually that is a $300 combination, and we have it right now for $200. So anybody who's getting ready for prom or a wedding, stuff like that, it's really good for. We also have another get ready for prom special, which is the dermaplane. It's another exfoliating facial, and that one is the one that uses like a little scalpel blade, and it's a mechanical exfoliation. So she just scrapes this, it gets all that peach fuzz off, all the dead skin cells and all that stuff. Again, your skin is really smooth, and afterwards she'll do a mask and all that stuff, so it's really hydrated and smooth, and makeup goes on really pretty. That's usually $120, and for the special it's going to be $89. So really like teenager safe facials that you can do at our place. The next one we have is a raffle, so you can purchase any Elastin skincare product. I carry Elastin, which is a product line that's manufactured by Galderma, which are the same makers of Dysport and the Restylane line of fillers. So any product you purchase of the Elastin will enter you in a raffle to win a combination treatment, which is 20 units of Xeomin and a bio repeal. So those two combined are really nice. Once the Xeomin kind of kicks in and your skin is healed up from that bio repeal, you get really nice glowy skin plus less wrinkles from the Xeomin. So it's like a double whammy for the skin. The other thing we're doing is get summer body ready. So we have a like an Easter hop into your bikini special. So we'll do the I offer semaglutide, tirzepatide, and rotruritide. All three of those are GLP-1s that are injectables that you inject once a week. The special is for 2 months of semaglutide for $400, which is usually $500, and 2 months of tirzepatide, which is $800, which is usually $1,000. And then 2 months of the rotruritide, which is a different one, a newer one that I've started carrying. And I've started a couple patients on it and some of my staff, and I've seen really good results with that one. And that one's 800 a month, or 800 for 2 months as well. The rotruritide, I'll go in a little more detail on that. So all three of them are GLP-1 agonists. The semaglutide is just the GLP-1 agonist, so it slows your digestion, it tells your brain I'm full, and it increases insulin sensitivity. The tirzepatide does that as well. However, tirzepatide has additional chemical makeup to it that reduces the side effects of the semaglutide. So common ones are nausea and constipation. The tirzepatide has much less side effects than the semaglutide. And then the rotruritide is a triple agonist. So it not only has the GLP-1, it has something that's called the glucose dependent insulinotropic polypeptide. So that is something that will help your liver burn glucagon as a form of energy instead of using muscles as a form of energy. So a lot of times with semaglutide in particular, you are just losing weight and the body doesn't differentiate muscle from fat. It's just grabbing any source it can to utilize that as energy. So the weight loss, you might get a little bit more muscle loss than what I'd like to see. With the rotruritide, you get more fat loss as opposed to muscle wasting. So it does the same thing. It enhances fat burning, reduces appetite, improves insulin sensitivity. Additional things that are benefits with the rotruritide is it decreases inflammation. So a lot of people are taking it not for weight loss, they're taking it for any kind of disease that's inflammatory. So that's going to be any autoimmune condition, cardiovascular disease, fatty liver disease, those kinds of things that are almost always due to elevated inflammation. They're using rotruritide for that because it's decreasing the risk of those diseases and helping people repair their own bodies from those diseases. It also helps with abdominal fat and something that's called visceral fat. So visceral fat is fat that is in the abdomen, but you can't see it. It's like internal fat. So it's fat that is kind of wrapped around and inside your stomach, your kidneys, your liver, all your internal organs. And that is the fat that contributes to risk of cardiovascular disease, diabetes, metabolic syndrome, those kinds of things. And rotruritide helps to decrease the risk of those because it for some reason it concentrates more on that visceral fat and that abdominal fat, so thereby decreasing your risk of those diseases. So it's pretty cool. The people I've had it on so far, which have been about 2 or 3 months now, I've seen really good results with it. I've seen excellent results when it's combined with hormone replacement. It's also something that can be added on to semaglutide or tirzepatide. So if you've reached like a plateau with either of those, like you're at the highest dose and you're not losing weight, you can add rotruritide to that and it will enhance the benefits of the other two. So that's that one. Real quick, I'll go over the VIP membership. So we still have the VIP membership. It's $129 a month. And basically what I'm doing now, I did have it more streamlined as to everybody will get this involved in that package. So what I'm doing now is we're kind of making a package for each particular person that focuses on your needs more. So instead of it just being a blanket program, one size fits all, it's more tailored to what you need. So for instance, we have a lady, she's been a VIP member for a while now, and she's been doing, some of the facial treatments every month for free, or an IV treatment every month for free. Now she's wanting to focus on some other things, and I spoke with her today, and so that's going to be the new treatment is going to be her free treatment once a month, because she's wanting to kind of do other things. So that's something we can always have a conversation about. It doesn't have to be that specific package. You do get a discount on toxins, so Botox, Dysport, Xeomin, and another one that I just started carrying that's called Latibo, are all going to be $2 less per unit. And then you get $150 off a filler per each syringe. And then that will include Sculptra and Kybella as well. So those are kind of some of the perks. You get 15% off any product you purchase. So any Elastin products you purchase, you'll get 15% off of that. And you'll get 15% off any other services you decide to do that might not be listed on the program. So if you wanted to do the M Sculpt or anything like that, you'll get an additional 15% off of those packages, or microneedling with RF, that kind of stuff. On that note, I was going to talk about another peptide we have. In addition to the Retruotide, I started carrying a bunch of different other peptides. One of them in specific is AOD 9604. And that one is great in combination with any of the GLP-1 peptides, so the semaglutide, tirzepatide, or the Retruotide. It reduces body fat, it regulates fat metabolism, stimulates lipolysis, so that's like the fat cells, it actually like kills them. So it lyses them, which means that they kind of burst, and then your body can get rid of that through its regular detoxification process through the liver and the kidneys. It triggers fat release. So again, it helps prevent muscle wasting from any of the GLP-1s. So it's really good in combination with the GLP-1s. But you can take it on its own. It's taken for 5 days a week. So you take it daily for 5 days, and then you have 2 days off. And you do a cycle of 8 weeks. And then you take 8 weeks off, and you do it again if you need to. You may not need to. You might be happy with the weight you're at or the fat percentage that you're at. And then you don't have to do it again. So I think that's, oops. What the hell? It won't let me wave at you, Nikki. Okay, there it goes. So I carry several peptides. That's just one of the many ones. I carry some for inflammation, soft tissue repair. So like ligament or tendon damage, or even muscle strains. There's certain ones for that I carry. Pretty much anything you can ask me, and there's probably a peptide for it. There's peptides for sexual dysfunction even. So there's peptides to tighten the skin, to grow hair. There's peptides for everything. So if you guys are considering something like that, then feel free to ask, and I'll be happy to answer that for you. Does anybody have any questions you would like me to answer for you? I'm just scrolling through the chats to see if anybody's said anything that I missed. Okay. Going once, going twice. All right, so let me see what we have. We have Nikki. So typically what I do on the lives is, out of everybody who's participating and here, I'll pick a winner for something. I kind of just decide on the spot which ones to do. So we've got Kara, Pat, Rachel, Oops. HP Mitchell. Okay, I think I got everybody on here. Let's see. All right, I think what we'll do is we'll give away a 8-week cycle of one of the peptides. I specifically talked about AOD 9604. So I think what we'll do is a 8-week cycle of that for free. And I'm gonna have, where's Liam?
Died.
He died. You guys want to see my dog? Where's Willow? Willow, where is she? Oh, here she comes. You guys want to meet my dog? Come here. This is Willow. Yeah. She's my baby. Okay, thank you. All right. Okay. That was Willow. All right, Liam. So we're going to pick one of these. So we got this HB Mitchell, Pat, Kara, Nikki, or Rachel. Circle one. You can pick whoever you want. All right. He picked Rachel. So Rachel, you can get a free 8-week cycle of the AOD 9604. So just text me or call me and we'll get that ready for you. And we'll have it all set. Does anybody have any, thanks bud. Does anybody have any questions or comments, concerns? Going once?
My Latin teacher says expressions of outrage.
Or any expressions of outrage. Rachel said, thank you, Liam. He's a little embarrassed. Yeah, Kara, I haven't seen you in like 2 weeks. She said, I need to book. I haven't seen you in like 2 weeks. You're usually there like every week. Where you been? You must be feeling good, so you haven't needed me. All right. We'll wrap it up then, guys. I will let you get back to your Monday. Be on the lookout for those texts tomorrow. If you're not due for a service or none of those services are something that you want to do yet, you want to start next month or something like that, you can call and pre-book those and prepay for those services. That way you can secure that deal while we have it. We're still doing the microneedling model call. So, oh, okay. Kara. So we're still doing the microneedling with radio frequency model call. So that's 3 treatments. Usually each treatment can run anywhere from $500 to $700. And we recommend you do 3 treatments, 1 treatment a month for 3 months. So we're doing a special for that for a model call. All you have to do is agree to let us use your before and after photos to kind of build our portfolio with that. And it is $891 for all 3 treatments. And usually that will cover a little bit more than 1.5 or so. So it's a pretty good deal. You just have to agree to let us use your pictures. And that can be done for the neck, the face, backs of the hands. I'm doing it like right here on my forearms because I got some weird old lady skin happening right here. So I'm trying to get rid of that. I've also been doing it on my abdomen to tighten the skin up from having these kids. The perks of being a mommy. All right, I'll let you guys go and I will see you guys on Monday. Have a great week, guys.